Welcome back on Montana This Morning. Joining us now via Zoom, we have Joe Solowaychik, a diabetes nurse educator with Billings Clinic. Joe, welcome. Thank you for being with us.
Casey, thanks for having me. I feel like I'm not here by myself, but representing all the 20, 30 colleagues that I work with at the clinic.
I'm
Thank
sure
you.
they're happy to have you speak for them. November, Diabetes Awareness Month. How
Yes.
prevalent is diabetes in the U.S. and in Montana in particular?
In the US, there's about 34 million people with diabetes, both type 1 and type 2. And in Montana, and that's about 10% of the population. And in Montana, there are about 77,000 people with diabetes. Yes.
So, I mean, it is still a prevalent disease that you guys are dealing with on a daily basis. And you practice what you preach as a diabetic yourself. Is that correct?
It's true. I've had diabetes now, type 1 diabetes, for 60 years. And I try and bring all of my personal experience to the game of working with patients and their families and trying to give them a sense as we empower them to take care of themselves by providing them with the best technology, the current state of the art technology, and the best education. I try and bring my personal game to the event as well, just to let them know that I know what it's like. Because I will tell you this, taking care of diabetes or having diabetes is not fun. And there's not one day in the last 60 years that I woke up in the morning and said, yippee, can't wait to take care of myself. But that being said, we try to convey to the patients that if they do take care of themselves and they do what they need to do, that they can have a great life.
There's often a misconception about diabetes, the differences between type 1 and type 2. It's not always just for maybe people who haven't lived a healthy lifestyle so far. It can really strike anyone.
Yes, it can. Some of the risk factors for type 2 diabetes are eating unhealthily, lack of exercise, stress, being overweight, smoking, and stress. That's type 2 diabetes. And ironically, we have a cure for preventing type 2 diabetes, which is just addressing each one of those lifestyle issues. The other kind of diabetes, in terms of the two main categories, is type 1 diabetes. That is, there's nothing you can do about that. You get it. It's an autoimmune disease, and there's nothing that you could have done to prevent it. It just happens. The body attacks its own beta cells, and you have type 1 diabetes. But like I said, with type 2, which is the more prevalent kind, we have the cure. It's just that people really don't like the cure that much, which means changing your lifestyle.
Sure. You mentioned helping people feel empowered. Can you expand on how exactly you're attempting to address that?
Yes. And, it's a great question. And it's like at the core of what we're talking about in terms of working with people and their families. Empowerment means to provide patients with the right care, sensitive, compassionate care, current state of the art technology that's available. These days now, you don't even have to come into the clinic. We can show you how to upload technology and have data that we can get your data and you can see us from wherever you live in Montana. You don't have to drive all the way to the clinic and get the same excellent care. So providing the technology that's available today, continuous glucose monitors as opposed to finger sticking, which is how I started with it. Actually, I started with urine tests. And then the right education, current state-of-the-art information about how to manage it. We empower patients by not doing it for them, but by trying to get them to understand that diabetes, unlike many other diseases, the clinical outcomes are mostly in the hands of the patients. It's not the doctor or the nurse.
Right. Joe Solowaychik, thank you so much for being with us. You've been here for about 10 months. We promise at some point you will get out to explore all Montana has to offer when there aren't shutdowns.
Thank you, Casey, and it's been a pleasure. And I just want to let patients know that out there that we're here to help you not only survive, but to thrive.
Good to know. Thank you so much for being with us. We appreciate it.